I'm Dr. Sasha Hill from Cleveland, Ohio.
Keith Green CJF AWCF.
You know, the very essence of the mental game is this. The only reason an event matters is because we make it matter.
Welcome to the Mullins Farrier podcast.
My name is Todd Walker.
I'm Sarah Mary Brown.
My name is Hayden Price.
I am Megan Coyle.
Hi, I'm Connor Sloman.
My name's Ashley Sloman.
Hi, I'm Derek Popeward.
Daniel Jones.
My name is Ellie Mae Watford.
Jim Blurton. I'm from Welshpool in Wales.
I went to Mount Mowbray, the army school. You know, it was this big forge with big oak block wooden floor, 7 fires, anvils and everything else. It's a fantastic facility. And I remember walking in there thinking, wow, this is where I want to be.
Most people that I know in this industry only want the best for the other people in the industry, which is a pretty cool thing.
Welcome, everyone. Surprise, this is another bonus episode, and we're releasing it in full as a PSA of sorts. As you've heard me mention before during previous shopkeepings, the National Alliance of Equine Practitioners is hosting their annual conference in Saratoga Springs. In the spirit of this event, we had 2 members of the board come on, a vet and a farrier who happened to work together in their shared territory near Cleveland, Ohio. As you can imagine, during this busy season, it was hard to find time where we could all get together for this conversation. And as luck would have it, on the night that we did, Mother Nature wanted to be a part of it. A storm rolled through just as we started, with Dr. Sasha's internet connection bearing the brunt of its disturbance. We lost her several times during our talk, but Keith jumped in whenever necessary and carried on the conversation. So that said, you will hear thunder through long stretches in the background. Those of you who have a subwoofer in your truck, you may want to turn it down. Despite the disruptions, we all persevered, and I'm quite proud of this episode. A topic near and dear to my heart, vets, farriers, and equine practitioners working together collaboratively is the main objective of the NAEP. So I'm very pleased to present you Keith Green, AWCF, and Dr. Sasha Hill. I hope you enjoy this conversation as much as I did. Thanks to both of you for taking the time to do this. I know you're both very busy. And
Thank you.
Thanks for having us. So I guess we'll start with you, Sasha. How did you become a vet in the first place?
Oh, way back in the day. I grew up around horses. I was a 4-H kid, and basically I was always really interested in lameness. I would always go to the barn when I knew my vet was going to be there. I was always really interested in what he did. And in wanting to always be around horses, as things always tend to evolve, I started grooming in high school, and then that was kind of my full-time job when I wasn't working at school through college, and then I did it professionally for 2 years after college. And so what I found was that as I was grooming and kind of spending most of my life on the road, I was seeing all of these different vets at the shows and meeting a bunch of different people and chiropractors and people that were doing acupuncture that were vets, and I just was enamored by the entire situation, and being the groom, the horse loses a shoe right before it's supposed to go in the class, so you're, jogging the horse over to the farrier, tacking on a shoe, jogging the horse back to the ring, and I just thought, I like what I'm doing, but I'm even more intrigued by the whole veterinary aspect. And grooming, naturally, you're always palpating the horse's legs that you're taking care of, because you're always trying to make sure that for your trainer and the rider, everything's good and there's no swelling and there's no heat and all of these things that most lameness veterinarians are naturally doing. And so that was kind of the pathway that set me up for, I'd really like to work with horses for the rest of my life. If I could be an equine vet, stellar, would love that. And then, that kind of happened. And when I graduated, I went to Ohio State, and when I graduated, I just had a lot of great people that I had met along the way that became great mentors, right? And that helped really ignite a fire of excitement about the whole sports medicine, lameness, podiatry aspect of life. And that's kind of where it all started. And I came up to Cleveland because of Dr. Ron Genovese, and that kind of just started a whole let's go. And that's kind of where it's been. And that's where I've kind of ended up and enjoy every day. It's a fun new challenge. Lameness is never the same. You can have the same problem in multiple horses and they may present differently. They might block slightly differently. Every horse responds to pain differently. It's a fun challenge and it's never really the same, and that's what I really like about it.
I hear ya. And how about you, Keith? How did you become a farrier in the first place?
Well, so I grew up on a crop farm, about 2,000 acres. And of course, had a pony when I was a kid, but the horses were hay burners, right?
Yeah. Similar
they were great to
background.
sell. Yeah, but great to sell hay too. Coming out of college, got married to a horse girl. I guess going to the fair with cows. I found myself intrigued by the horse barns. But so my previous wife was into horses, and I was trucking on the side with farming, looking for kind of my own deal, and that wasn't working out very well. And her farrier grabbed me and said, "Here, try this." And friends with him a little bit, went down that path, and needless to say, farrier stuck, and the marriage did not. I was told by that guy that he's like, "Oh, you can't farm and shoe horses," and I thought I could do both. And he's like, "Oh, you got to do one or the other," and he was not wrong. I think if you want to be successful in this, so whatever point after I got divorced, it was sink or swim. So I jumped off the ship feet first in the deep end. It started paddling hard.
All right. It is one of those things. You have to be all in or nothing, it seems. Yeah.
Yeah. My father was real. He thought, man, there's no way you're going to ever make a living at this. And it's kind of one of those we grew up with. You leave the farm, don't come back. There's not going to be.
Oh, really?
Yeah. Later, he thought, well, maybe you come back later, but I think it's best. My brother's there, and we probably wouldn't work. We get along great. We would not work well together. Yeah. Especially after the lessons I've learned going out on my own.
Yeah. And then how did you meet up? What was the first case that you and Sasha worked on together?
I'm going to let Keith take that one.
So I think she's going to let me take this one.
Okay.
Yes.
So there was a barn, actually not far from the clinic that I was doing the horses at. There was some friends of mine from Civil War reenacting. There was a laminated donkey there named Ears. And I had no clue that was coming that day. And she showed up and said, "Oh, yeah, we're getting you x-rays on this donkey." And I'm like, "Oh, splendid." And she shot the x-rays, and Chris asked her she'd do something else. And me being the witty, sometimes I can be, rattled something off, kind of offhanded to her, and her being Dr. Hill. And man, quick as a wink, she spun around and fired right back something just as witty. I don't think either of us can quite remember what it was, but it was one of those. I'm like, damn, all right, I like her. She's going to be all right.
And that was the beginning. Yeah.
Very cool.
Yeah.
And how did you make out with the ears?
I do remember the x-rays are very helpful, but I
think he had some laminitis. Yeah. Yeah. Go figure, an overweight miniature donkey.
Yeah. Well, yeah. But it's been quite some time since I worked for them, and I'm not sure really what happened to the donkey after that.
Okay. Gotcha. That's the beginning of your first meetup. And then how did the relationship build from there? Was it always just that particular barn, or did you start running into each other elsewhere?
To be honest with you, I didn't really run into her much. It was kind of seemed like a mutual respect. I think a couple times I've run into her, have a conversation, and then slowly pick up more things here and there.
I was just going to say, we started overlapping on more barns as time went by. So I think just as clients that you and I shared mutually over, because we've been working for 10, 12 years-ish, air quote, right? So yeah, I think, so I would say probably in the last 5, 6, we've had a lot of consistent overlap.
And what are some of the more interesting standout cases that you both have worked on together?
Yeah. So, I mean, one in particular, well, we've got a couple that I think are definitely good ones to share. One for sure would be a canker case that we had that was a good one. So it was a 23-year-old paint gelding, and the horse was from Western PA, and it's a client that I see not terribly regularly, maybe once a year, and nice horse, never had any issues that I was aware of before. And the owner called me, and the farrier had noticed that something, wasn't right on his feet, and it was affecting 2 of his feet, and the owner sent me a couple pictures, and I said, oh, I think you have canker, but I'd have to see to be sure, but it sure walks, talks, and quacks like a duck, so I'm curious. And he kindly, and I had kind of, at this point I hadn't even mentioned anything to Keith yet, because I was just, case is going to come in, let's see where this goes. And it came in, and it did have canker, and it was affecting the right front and the left hind, and it was pretty significant. The right front, it had clearly, at least in my opinion, been going on for a while. It involved the medial bar a lot, and then went up into the digital cushion, and then affected the medial aspect of the frog. And then the left hind involved that central midline aspect of the digital cushion, and then extended over and into the central sulcus of the frog. So it was pretty notable on both front feet, and so then I resected and went to town on both of those feet that day at the clinic, and then did a lot of bandage changing. The owner's daughter was really quite capable, awesome. I told her if she wants to become a technician, she should let me know. She got really good at doing wet to dry bandages, as I needed a good healthy granulation bed, and this horse needed to kind of start to regrow this medial bar on the right front. And so during the bandaging process, I reached out to Keith and I sent him pictures and said, hey, I've got this interesting case. The Farrier over in Western PA, I've reached out to him. He seems interested, wants to kind of learn more about this. He'd never dealt with canker before. And so I said, hey, let's do a meetup. If we can get the Western PA Farrier and then you and me together, we can all just let's all sit together and try to make a plan for this horse. And so that's kind of how Keith got involved in it. And he jumped at the opportunity for sure. He's like, oh, this is going to be fun. and the Farrier, I think, unfortunately had like a personal conflict the first time that we had tried to meet up. I think his daughter was getting married, very legitimate reasoning. And so we did a conference call with him while Keith and I were at the clinic. And I mean, you can take it from there, Keith, in terms of conversation, but it was great.
Yeah, so the horse was jammed pretty hard immediately on, I think, fit of both front feet. I mean, like you were talking about, the bar was involved in a bit of a right foot. I think we wound up, I don't think we did a lot of shoeing, especially for the canker, more so kind of re-support the foot. Went with a wider medial branch, pulling it out. And I think we built it up with Equilux, I believe. Kind of just re-stabilized the foot. Horse all the way around, got to the hind feet, and I do remember it quite well there. I don't think it was so bad, and you spotted a little spot of canker that you decided was still there, and I came in with a hot shoe, and she's like, put it right there, burn it. We did, and that was...
Get it. That's what I said. I was like, yeah.
I'm not gonna lie, I burned a lot of feet, right? But I was a little apprehensive on that. Like, you sure?
I was like, what's the worst that can happen? We're all here.
Yeah, I mean, it was, as canker can be, it was pretty open tissue there. So I'm like, man, this thing's gonna... He's not gonna like this, but it was well sedated. Yeah, didn't even flinch.
Yeah, he was great. He was good, and he was a good horse in general. I mean, he laid on you, but other than that, he was. Yeah,
that's right. I didn't forget about that.
Yeah.
I think a lot of it was just trying to re-support the foot, get that medial side to quit rolling under a little bit and re-support it.
And you did that with a wider branch.
Yeah, there wasn't really time to really make anything, but I think I double fullered the medial branch, and then I can't remember if we put him in pads or not. I'm thinking probably no.
We kept it open so that the owner could do bandaging.
But then Equiloxed it out to kind of re-support, get him standing, even.
Right.
Yeah, I couldn't quite remember there. That's been a couple of years ago now.
Now, Keith, with canker, I've been fortunate in that I've never had to deal with it. I had one horse where we suspected that's what it was. It just had this one really sensitive spot. It was a draft horse, so that kind of also made us
a little prone to it.
Yeah, and it turned out, it just because the horse was turned out in this limestone screening filled paddock, it was actually the limestone screening and something to do with the acidity in it had actually eaten into the frog and created this very sensitive spot that we just couldn't get rid of until I did a bar shoe and a hospital plate for it. But with canker, it can be super sensitive. It also bleeds a lot, does it not?
Yeah, and that's what I was a little, like I said, a little apprehensive there when we went to
Hurting it.
cauterizing.
Yeah.
I had one case we suspected of horse had some, I think some liver issues, urinated just copious amounts in its stall. I don't know if that's when I took it on at a barn I was at. Anyhow, little suspected of it, kind of started right in treating it. And then I got a hold of Mike Wildenstein and picked his brain. And I tell you what, that was time well spent. And
Yeah, I bet.
he put us on a treatment, and I think it was white lightning, and then coming back with mastitis medicine. And then big thing on him was changing the pH in the stall. So it's kind of interesting when you said the limestone, lime the stalls, and that really did not turn into much.
Okay.
It was an unusual case in that this horse had a really clean environment. The gentleman that owned the horse was really meticulous, and I had proof of it too. His daughter would send me videos of just the horse's stalls and where they were, and it was very clean, very dry. There was nothing. What we came to find out was that there were really long intervals in between the horse getting trimmed, more like 8 to 10 weeks, and sometimes just longer. And I think that was a main contributing factor, was just management. And so that was something that I think Keith had a great conversation with the farrier over there, and just discussing. He had mentioned, he just was trying to shoe to get the foot back balanced and getting the hoof underneath itself. And I think that was a part of it. The horse had just gotten so far ahead that it had outgrown a lot of things. There was a lot of things that Keith addressed in the first couple shoeing and trims for sure.
Right.
Well, like, at those longer intervals, length was becoming leverage and really working against that horse, and clearly wasn't going to get ahead of it that way.
What is in your area? You're both south of Cleveland. What is a typical interval for farriers out that way?
So I really like 5 weeks, especially this year right now. We're getting a lot of rain, and the horses are getting turned out a fair amount. Every barn's different, but different environment, but it's showing in a couple of them. But I like 5. I've got one barn that really insists on 4. We get through it through the summer months, when they're growing fast, we're good. But kind of get in the fall, I think we could really stretch it to 5.
Right.
I like 5. Coming in winter, 6 to 7.
Okay.
The winter.
Yeah. And is that similar with most of the places you deal with, Sasha?
Yeah, I would say 4 to 6 is pretty average for most barns that I go to. A lot of the quarter horses tend to be on the 4 week, and then a lot of the warm blood type, thoroughbred type horses are 5, 6.
Okay. Gotcha. Now, you had mentioned there was a second case that stood out for you both.
Yes. That was a keratoma case that we had, and that was a 17-year-old quarter horse gelding that had chronic recurring abscesses in his left front foot for years prior to one of my associates seeing the horse, and had taken some x-rays, and the horse would the intervals kept shortening, then it would abscess. Sometimes it would abscess out the toe and have a subsolar abscess, and then other times it would gravel and it would come out the coronary band. And so the horse came in off of a referral from one of my associates. She'd taken some x-rays, had seen that quintessential concavity to the dorsal aspect of the coffin bone where there'd been that pressure between the hoof capsule and keratoma that had occurred because it'd been so long standing. And the horse was actively abscessing when it came in. And so that was nice because that makes making a window keyhole into the dorsal hoof capsule really easily. It was just like, okay, we'll just drop right in and then we'll just start removing. And there was just a lot of purulent material. There was a lot of the epidermal and the dermal lamina were just so damaged, and there was a lot of angry tissue going on in there. And it ended up being one of those splinter-like keratomas, so it went all the way up to the dorsal coronary band, and so it made kind of a keyhole down the central dorsal hoof capsule and then went up to the coronary band from there. And that was one that I had let Keith know that was coming in, but I think just with scheduling, and I kept the horse at the clinic for a couple of days just to make sure that the horse's pain and just had a good bandage change. So then Keith came in, I think, a couple days later and was able to help stabilize that hoof capsule with some stuff.
Now, what was that stuff, Keith?
So we shot him with a bar shoe. It was a handmade, but it was one I had stocked in the truck.
I love it when that happens.
Yes, isn't that handy? So I'm a little old school, right? I don't buy them. I try to make them, or keep some made in the truck.
Right.
In times like that, you don't have time to make them. Anyhow, and then just went with a flat pad with Equipack for some frog support for the time being, and that foot was really distorted. It was definitely, he was shooting out the front pretty bad, and I did follow up on him. I would say about 9 months. I don't think I quite got the whole completely grown out. There may have been like 3/8 of an inch left. So maybe it was almost a year, I guess. And didn't tell a lot that day, but in the resets after that, when we were doing them, man, I bet there was at least 3/4 inch tearing in the white line at the toe where that keratoma had been.
Right.
And just the distortion from it was pretty impressive. And then all the tracks in the sole from abscesses, and that hoof was a mess. But as it kept growing out, I think she went back and resected a little bit more. I think there was some loose material from an abscess cleft at the top that was kind of hanging there. And after everything keratinized, we talked about it. And then I went ahead and built an aluminum plate and plated over the hole once we knew we were past any infection. Everything was keratinized. And equiloxed that and then screwed it in. And then that really helped stabilize, I thought, the hoof caps. Did a nice job there. We continued with the bar shoe and the frog support, or the sole support, really. With bar shoe, there wasn't isolating the frog so much.
Was that a horse, Keith, do you still shoe that horse, or did you transfer that back to the
original Farrier? Yeah. He was barefoot, I think, prior to. We put him in shoes, got him through that. I think we shoed the other foot also with definitely, it was just a open shoe, but I did pound out the pad on that and shoot Equipack under the frog, try to get some supporting limb help there. But kind of when we were just about done, I think he plucked the shoe, and it was, like I said, it was about 3/8 of an inch from it being completely grown out. And we decided to go ahead and try barefoot. I think he went fine. They scheduled one more time, and then they actually did not follow through. They called and canceled it and said that he's great. And we were already planning on their Farrier taking him back a horse. So, and I think
I was just going to say, when that case started, we'd reached out, and that Farrier was more than happy to have Keith do this. So this wasn't like trying to, the whole point of everything is work well with others, right? So this was one of those cases where the Farrier that was the routine person for this horse talked to him about the case, and he said, this is not really something I want to get into, so if you have a person, please get them involved, and then I'm happy to be around when this is done, kind of a thing. And so that was great, because there was no animosity, right? He was happy to have this happen. Keith was more than happy to play his role in all of this and then hand it back to this gentleman so that he can keep doing what he does, and everyone played well together, and that's ideally how I like those to go.
And that makes for a much better result, does it not?
Yeah. And the more we can do those types of cases, that was what was always so interesting too, was in all of these different cases where Keith and I have worked together, he and I know each other really well at this point. The discourse that we have is different now than when we first started. When we first started, I was the greenhorn that was like, hey, here we are. And this is what I think. And then years pass, and I've learned more. I'm still learning. All of us are always still learning, but I feel more confident with my diagnoses usually, or even if I don't, I'm more aware of what I'm probably missing. And so then I can bounce those ideas off of Keith really nicely, and then he can say, okay, based on this, I think we should probably do X. It makes it very streamlined.
Yeah, I mean, you can go, okay, this is what I'm taking. This is what we have. These are the pathologies. This is what I'm taking. And, I'm going to take in consideration the horse's environment, what I'm seeing in the foot. And, we all kind of have our own things we do, our strengths, and then we tweak to that. But, I think when we can bounce things off each other, it makes things go really well. A better outcome for the horse.
Right. And since we were speaking about keratomas, what is the cause typically of a keratoma?
I would love to have that answer for you. There's a lot out there. I think the
There's
answer
theories,
is quite
right?
yes. There's a lot out there.
Yeah,
There's a lot of yeah. I'm not going to be the person that's going to tell you this is how, because I quite honestly don't. I think it's highly variable. I think sometimes it's trauma, right, and irritation within the white line, or sometimes it can be something really silly like a foreign body that kind of aggravates things, and then that's a different type of trauma. But the literature out there has a lot of different possibilities, and since there's different types of keratomas, you can sometimes get those spherical pearl-like ones too. Clearly they all come from a different origin and pathogenesis, and it would behoove me literally and figuratively to say that I know the reason, because I don't. I really don't. So I just, if it seems like it, I'll send it off. A lot of times I'll send some of these off for histo just to feel more confident about what it actually is. And in this case with the keratoma, it was. But sometimes I've sent things off and it's not. It's maybe some sort of a weird granulomatous reaction that they don't classify as a keratoma, but, weird, just kind of oddities. But I don't know the definitive reason for why at all by any means. I'm sure there's people out there that have much better answers than myself.
So it's interesting you say about the aggravation or concussion. The Ontario Farriers Association years ago did a clinic and we did a dissection, and it was one of the farriers. It was her horse. And this guy had always had sore heels and always had the really serious corns. And when we dissected him, he actually had the little pearl-like, just basically almost like cartilage, it felt like, in his heels. And we thought that was interesting. I think we x-rayed the foot because we had a vet there and they didn't show up. And I had later on, about a year later, a horse that was chronically sore in the heels. And I tried everything and could not, it didn't matter what package or how I floated the heel, whatever, he seemed to always be sore. And eventually the vet was there and one of these little pearl-like, it just came out. So I sometimes wonder, some of those chronically bruised heels, if it's not the hoof's reaction to that and it builds up this little bit of cartilage or whatever
tissue. It's very interesting.
It doesn't show up on an x-ray. It's just hidden there. It pops out. Yeah.
That's very interesting. Yeah. And there's a lot of people that do these a lot more than I do. And I haven't seen two cases that are exactly the same. They'll have similar presentations and they'll do similar things, but they're not always the same.
Yeah. Now, have you ever come across, I guess we can voice this both ways. I'll start with you, Sasha. Have you ever come across a case where you and the farrier have very differing opinions on what should be done?
Oh, I see.
And was there a way of overcoming that?
Yeah, I guess what I'd probably say is in the way I usually present a case to the farrier, at least for me, is I'll just let them know what I have found in terms of the diagnosis. We're lucky at our clinic that we have a standing MRI, so I can oftentimes get a really specific diagnosis based on the horse's previous block history. So not just x-rays or ultrasound, which are wonderful, and we use those every day, but then we can get a little bit more of advanced imaging with the MRI. And so I can get really specific with whomever the farrier is on the detail of the pathology, which I think then sets the farrier up as best as possible for how we want to do this. And as I think we all know, especially with different varying pathologies, the shoeing is going to change over the course of the healing if the pathology can heal, if it's a soft tissue injury, right? So where we may start with the injury and the shoeing might be totally different in 3 months and then different in another 2 months as the horse's exercise increases or isn't allowed to do more. And so then I usually don't tell them this is what I want. I might have ideas. More specifically, I tend to have ideas of what I don't want because I know some horses with, you've got, say, different podotrochlear disease, and maybe the horse has a lot of navicular bone trauma. Maybe it just has a degenerative navicular bone with flexor cortical erosion. And then because of that, it's had long ongoing bursitis. And then maybe it's finally now decided to have a lesion in its deep flexor tendon. And then that's maybe why it came in. So it's got all of these different pathologies, and prognosis may not be great because of different variables involved, but all I know that a lot of those horses really don't like central frog pressure because that's going right up underneath all of that. So I'll present all of this to the farrier and say, based on this, you know the horse, you see the horse's feet all the time. Please tell me what you want to do. But if they say something that or maybe I just don't know, because most of what I've learned is from all of the farriers that I work with, if it sounds like there's going to be frog pressure, I would say, will that cause that? And they're like, no, the way I'm going to do it, it's not going to happen. Or they'll say, oh, that would. And I'll say, okay, how can we do it without frog pressure? Because I know that's going to make this horse sore. And so then we can have a good discourse. And then whatever our conversation conclusion is, then that's what I try to emulate in the report so that then the farrier and I can have a team response sharing it to the rider, the owner, the person that owns this horse, because I don't want it to be a presentation of the team is the key, in my opinion.
A united front.
A united front, and then there's less arguing from the opposing side back.
Right.
So it makes it very clean in that sense. And I can't put a shoe on a horse if my life depended on it. I can take shoes off, but I cannot put them on. So
but can you take them off without half the hoof wall coming with them?
Yes, I can. And Keith can vouch for that.
Yes, you can.
But yeah, so that's...
And that was not my doing.
But that would be... So I guess I don't tend to do shoeing prescriptions per se. I tend to do it that way.
Okay. Now, how about you, Keith? I know I have run into certain vets who will just give you a prescription and that's what they want you to do. And you might not even agree with it. So... what do you do in those situations?
So I guess I go with, I really try to keep as best I can an open line of communication with the vets that I work with. And there's a lot more than Duck Hill. But, you know, if we can have that open line of communication, they rattle off what they want, what they're seeing, and I will come back with my ideas. And usually they just kind of stop, look at me and go, yeah, that's great. Or, you know, or their concerns with it. And I think where we really start to run into problems is when the vet's giving a prescription to the owner, or not even giving a prescription, they're telling them. And then we got the whole game of telephone we used to play as kids. Right? And it gets, and then when you talk to the vet, I've found more times than not, they're like, no, that's not what I wanted at all.
Yep.
So typically I really try to do that. I did have one vet one time. We kind of were working through the horse. And I thought it was going really good. And actually, my apprentice was standing there. And all of a sudden, out of nowhere, he just goes into this dissertation on navicular prototrochular disease. And however, he did not call it that. And then started comparing the deep flexor tendon to a hot dog. And it was about at a third grade level. And we just kind of let it go, did our thing. And Esther kind of looked at me afterwards and really did, what the heck was that? So that one was a little weird, but I think a lot of it is, you know, I think good communication between the vet and farriers. You know, not that you want to keep the horse owner out,
no,
but we really need to have a conversation. And I think communication, relationship building, but it also comes back to mutual respect with each other. And I think when we don't have that mutual respect for what the other one's doing or their capabilities, I think, you know, I think we've all been there, but that's where we really have problems.
Yeah. For sure. This might be off topic or might be fine. I know in a lot of discussions I've had with fellow farriers, sometimes it's not even the vet that will have an opinion, it's other body workers, which is something that it has come up more and more frequently. I just wonder if either of you have advice on how to address that when it comes up.
Yeah, Keith, since you're married to a body worker.
So I'm married to a chiropractor.
Yeah.
I'll have to say, I think because, you know, she's married to a farrier and, you know, I guess a double-edged sword for her, right? That she knows, and there's, I guess we're going to caveat that with, you know, there's many different levels, right? Yeah. We are held to any kind of test here in the United States. And so there's varying degrees of knowledge, and she can sometimes, with my background, be privy to a little more. And she's been into horses her whole life. She's got, no offense, Sasha, but I don't know anybody else I've seen that's got a better eye for horses and horse movement. You know, I think vets do it a lot, but since a little kid, you know, she'd watch and that blows my mind. But she's got herself in Farrier, I know, had some comments that she's like, hey, I really think this horse may benefit from back shoes or, some lateral support behind. And I think they were okay words, but I think there was some grumbling, what the hell, she thinks she's a Farrier now, kind of. Yeah, I think it was also a bit of a poke back in my direction, but, it gets touchy, and she well knows it too. And I think a lot of times she sees things and I hear about them, but we all have I'd say it's just the same as me. I think I can definitely feel a difference in the hind end of a horse when they're needing it. And, I got to be very careful what I say. And they may use somebody else or they may not be. And so that's a touchy ground. But I've heard some pretty horror stories from others. Sometimes they can be maybe a little bit more prone to saying stuff or giving their opinion, right? Out of turn.
Yeah, I think that's where the educating comes in, right? Because we're all different practitioners, right? So, the chiropractor, the acupuncturist, the veterinarian, the farrier, the nutritionist, we're all different practitioners. And I think the hard part and the part that we're all constantly trying to work on is that collaborative effort. And so I don't think it ever comes from a place of malice, right? It's a person expressing their opinion about something that they do every day. But again, I think it takes practice to communicate, right? So how we relay what we're thinking and how we do it in a respectful manner and how we, there's definitely times where I think, okay, I don't love X about this horse, but I am not a farrier, so I just need to understand more. And then every time I reach out to the farrier, they're like, I'm doing this because of this. And I'm like, oh, duh. Okay, this is why I called you, because now this makes complete sense. But if I hadn't, it would be really easy for me to just say something offhanded to the owner, and then that gets a whole situation, right? So to your point of other practitioners being involved, we all need our chiropractors and our acupuncturists and our people that do all these different things. I think it's figuring out how to, again, like what Keith said, have mutual respect, communicate with them. It would be ideal if that person saw something and then knew a person that was affiliated with the horse and asked them a question. You know what I mean? I think it's the constant, how do we better ourselves for the horse to make this the best outcome possible?
Yeah, I think even what you had said, Keith, about us being unregulated, there are even certain types of body workers. It's just a course that they've taken online, and it's not, they haven't gone through a school. They don't have a degree,
Called a 3-day quick school.
Yeah, and there's quite a bit of that in my area, at least. And so I think, Sasha, I like what you've said there, because yes, sometimes it's that Dunning-Kruger effect kicks in, and if you've taken a short course, all of a sudden you know everything you need to know about it because you don't know what you don't know, and then you have stronger opinions. I know there was a period there where in the beginning I had stronger opinions, and then they definitely tapered back a lot as I learned how little
I know, right?
Knew.
Yeah.
There's a greater power that's pretty good at humble us when we need it.
Yeah. Yeah.
Yeah.
I'm pretty sure.
Go ahead, Sasha.
Oh, I was just going to say, I'm pretty sure I am much less intelligent now than I was when I graduated. Yes.
Yeah. And I wonder if either of you have had situations that you could talk about where you actually thought, I don't really think this is going to work. Whatever you've suggested, like whatever the vet suggested to you, Keith, or the farrier suggested as a solution to you, Sasha, were there any situations where you were actually pleasantly surprised and learned something new?
I'm sure I have, probably many times. You have one, Keith?
No, just kind of in general. I mean, I think we get that. I've gotten that in past different times, a little bit here and there. And at the end of the day, may not agree, but if I don't find it detrimental to the horse, you may go ahead and do it and see what we get. It becomes a learning opportunity too, right? The other end of it, and we see where it goes. The other side of that, I'm probably into a bit extreme ownership, but I still have to deal with that. If it goes bad, the vet prescribed it, but I still have to contend with it. If it goes bad.
Yeah.
But so I would say still keep a watchful eye. But I think it's still a good learning opportunity, right? It's going to open our horizons as long as we're not uncomfortable with it. but it's not going to, or we don't see it detrimental to the horse. And if we do, we bring it up, and I'm pretty sure the vet's either going to set our mind at ease or go, oh, I didn't think about that,
Right.
I can't place any of them, but there was some that I probably gritted my teeth and went, okay, we're going to do this. And I don't remember any devastating consequences, but I will say, I think they're learning opportunities.
That was how I started to approach things. There were a few things where I thought, I don't think this is actually going to help. But one I can think of, I had a horse that really sickle hawked. It really crushed its outer heel, and it just wouldn't grow. And I was always trying a really broadened lateral extension, trying to help support it, and it just wasn't working. And the vet wanted me to do a trailer. And I thought, this is crazy. Like, it's just going to add more leverage to something that's already getting crushed. And I put it on because I really respect the man and thought, well, hey, what I'm doing isn't working. And it actually, within 2 shoeings, the foot looks better and it's growing some lateral heel. So I could see from the look of surprise on your face, Keith, that you probably didn't think that would work either. And who knows, maybe this is just a rare case, but I was very surprised to see it happen.
I would say that's probably not my favorite modification.
Yeah, no. And this particular vet, he does ask for it often. So I thought, oh, well, we'll try it because you have been asked for it. And in this case, it turned out to work out very well. It taught me the lesson of, those times where you're like, I really don't think this is going to work, but let's give it a shot. That, it can go in a different direction. And at least if you've got the vet on your side, they've suggested it and you've embraced it, then it either goes well or it doesn't, but you can united front once again when you discuss it with the client.
Yeah. Well, I think there's a place for everything. We just, and that modification has been around for a very, very long time. Mm-hmm. So it clearly has this place. It just, it's not one of my favorite.
But to both of your points, I think when you try something, I think this is where it's important to educate the owner, per se, quote unquote, whoever that person is. If this doesn't work, that doesn't mean it was a failure. It just means we need to try something else. And so I find myself having those discussions with owners a lot of, we're going to start with this. This is what the farrier and I discussed. This is what we're going to try. But I don't know if your horse is going to love this, but we're going to see. It's definitely not going to hurt, but we're going to try it. And then if it doesn't, we have a plan B, and then we have a plan C kind of a thing.
Yeah.
I think we throw a lot of stick against the wall, right? We're kind of to her point. I think sometimes we had a trial by error, and I think we learned a lot more that way.
Yeah, I learned a long time ago that you don't say, this will definitely fix your issue. Those humbling lessons.
Yes.
When the multiple choice true or false used to be on the CJF and CF test, it was always, every, and never.
Yeah.
Was the only thing always is going to be, they were going to be false.
Yep. Yep. Very true. And I guess one other thing, another tough topic to cover would be for you, Sasha, when you are dealing with people of varying skill levels, like you can run into people who actually don't realize when they're maybe doing something detrimental or not helping. How do you address those situations? What does that look like for you?
Yeah, and that can be a challenge, and that's where we have a fair number of referrals in, and so oftentimes I won't know the farrier. So I'll make it a point in referral cases if the owner's okay with it and if the referring vet's okay with it, because again, I think it's just as important to have that mutual respect, not just farrier vet, but vet. You know what I mean? If they're okay with me talking to the farrier, I'll just feel out, this is what I found. Have you dealt with these cases before? I just kind of start to feel, because I don't know what that person necessarily knows. And usually within 5 to 10 minutes, you get a pretty good understanding of if they've ever dealt with these types of injuries before. And even if they haven't, if they have a good foundation of anatomy, that's the key, right? Is just having a good foundation of knowledge to at least the mechanics make sense for what you're going to be applying to the foot, because you understand how everything works and interacts within the hoof capsule and above. So I'll often start there as a base.
So I think as farriers, sometimes we may get a little frustrated, vets saying what they want. But I think one thing we really have to remember is they're dealing with all levels. They're dealing with somebody as high up as an FWCF and all the way down to somebody just out of school or somebody that maybe never went to school and can get shoes on a horse. I don't know that we always appreciate that, that's something they have to contend with. And that's something kind of more recent that I've come to realize and understand. And like, man, that's a heck of an obstacle. But then I guess it would cold on our end. Sometimes I don't always get to work with a vet that maybe is as passionate as Sasha is and is thorough. But, it's the same thing. I do have to work maybe, I would say different levels because at least they've all passed the same test. They all come to it with the same base knowledge level. So, you got a pretty good idea what you're dealing with where they really don't.
Yes, that's true. It's a really good point. And I was going to ask Sasha and yourself, it led into this, what is something that you, Keith, wish that every vet knew about farriers, what we deal with?
Yeah, and I think a lot of it is, I think we already touched on the not necessarily giving a prescription to have a conversation, but kind of interesting. Another vet at her clinic brought up to me, she was working with my apprentice, and it was kind of a funny, she goes, well, can you put trailers on this horse? And she's like, well, I can, but what's that going to do? And they got talking about it, and they don't really know the modifications, right? So to her, trailers were extended heels. Somebody going through the certification process. One thing, extended heels is different. So, that's something that vet and I have talked about, hey, can we get together and kind of have little, know the shoes, know the modifications. I do a lot of roll toe in my shoes, and I think that would probably get back to Jason Critton and the foot landing and the synthetic footing, try to get a little ski effect, but it also eases the brake over a little bit. And I know the vets like that, but I'm not one that's going to slide it off the toe a whole lot typically. And if they can't see it, they don't think it's there.
Yep.
It's not something they're going to look at the shoe. And I think that's just a little bit of a communication or an education. It was kind of funny. I was talking to, I guess then reversed the other way. I had a conversation with Dr. Greg Stoller, about some other stuff, and nail placement was in how he doesn't like high nails. But I'm going to go pretty strongly the other way on that. And we kind of talked it over, hashed it out. It was quite interesting, right? He doesn't come by that because he maybe doesn't know our end, but he's had bad experiences, right? How many horses have come in with hot nails and they're high ones or, but and to me, that's like, okay, we need to step back and go, okay, proper fit, proper stocks dimension for that hoof, and then we should be able to drive the nails. You could really drive the nail and never come out and not hurt the horse.
Right.
I don't think they understand that.
That's great. Yeah.
So, but I wouldn't have got that if I didn't, pull that thread as him and I were talking.
Right.
He's not. He's got a valid reason he doesn't like them. We did not have the time to go a deeper dive, and then,
But in the future, that's a conversation you can have to kind of.
Yeah. I mean, it's kind of an interesting stockpiling those little things to, okay, where do we go with this to help?
Yeah. Sasha, what is something that you wish all farriers understood about vets, or something that all farriers would do in communicating with you or dealing with people of your practice, your profession?
I would say probably when the farrier is proactive and they maybe just give me a call because they see something that's changing with the foot in some way. So maybe the hoof capsule was a certain size and shape and now it's changing. Maybe it's developing corns. Something's changing and they give me a call. And then that's really helpful because you guys see the hoof capsule every 4 to 6 weeks. I'm not out there very often usually. I might be out there 2, 3, 4 times a year. And even then, if I am, if the horse is quote unquote fine, I'm not looking at it. So I think those times where I get a call and they're noticing something and then we can talk about it just between the two of us and be like, okay, what is going on with this barn? And maybe something's changed with the turnout. Maybe we've had a really wet spring. maybe they insist upon turning the horse out, and no matter what the weather. And so now we're seeing a lot of changes to the foot or something like that. And so then I can then bring that up, or we decide how we want to bring that up with the trainer, and then try to make it something that we can prevent. If we can keep it as a preventative measure, I really like it than waiting for soreness or lameness or pathology to develop.
That's great.
Yeah.
You looked like you wanted to say something, Keith.
Well, I was just kind of on hers. I think as farriers we're watching, and you start seeing hoof morphology change, and it starts adding up to postural changes or maybe a soreness you're noticing here when you're working on the horse. And to me, that's kind of when I'll try and bring it up to somebody, right? Hey, I think something's going on here. But you also got to watch not everybody wants to hear that either. It's how proactive does the other end want to be?
Yep.
Some like, well, why do you know? How would you know that? And like, to her credit, she's saying that she likes when she hears that, right? We don't have all the fancy tools. We have to use our eyes and really listen to the horse, right? And the horse gets a vote.
Yeah. I've actually run into vets who actually have said, I don't like that this trainer is always commenting on things. They think they're almost delving into it too much. And yeah, I think all the information is helpful, and you can sort through it on your end, and whether you want it or not, you can still decide to do something with it, or it's not important.
Yeah, and I think the hoof morphology, if you're watching it grow out, seeing the changes come from the coronary band, as you rebalance the foot or change your trim and how that affects the hoof capsule, if you're really paying attention to it, it's really cool.
I think that has been a common thread through a lot of the interviews I've done. The people who do really well are the ones who pay attention to what they're doing and are constantly critical of their own work, or constantly watching what's happening after I try this is what occurred on my next shoeing. Instead of just phoning it in and getting the shoes on, trim the foot, get the shoe on, and go home.
Yeah. I'm probably guilty of taking a little too much time with a lot of horses, but I don't know, constantly analyzing, looking. We're not going to get the trim right every time, but if we can kind of keep it between the lines, right?
Yeah.
Yeah. We see something different every time. Our mind's in a different place every time.
Yeah, and it's amazing how many people in interviews noticed, say they were at the beginning of their journey or quite a ways in without much education. They just knew that something wasn't right. And that's what caused them to look for more information and go to clinics or get help. So, yeah, it's interesting. The hoof tells quite the story.
This may be a little bit of backtracking. I hit on something I've forgotten. I think a frustrating time I had one time was they were injecting the horse, 6-figure plus horse, and they inject it, and then within a week, 2 weeks, the horse is off. And they kept coming back to feet, and they kept pointing, looking at me. And at whatever point, I don't know, it was the first go round or second. I mean, because this went on for, probably 3 to 4 different rounds of injection over, 2-3 year period. But the horse would go off, and at whatever point, I trimmed the feet probably 2-3 shoeings later. And I said, man, there is just a little bit of stretching in the white line at the toe here. Yeah. And I went so far as to got the W Rand ruler out, right? Took a picture, measured, kind of started plugging it, and called the attending vet and let them know. And I think maybe that's where she's going to on that is, where if she was the attending vet on this case right now, it's probably a different story. And unfortunately on this one, I was it was poo-pooed, and it was like, that's silliness. And I had this suspicion. I wasn't smart enough at the time to put it together and know it. But unfortunately for this horse, a bit later down the road, probably 3 more times, and I got to the point where I was really, really suspecting it every time they injected this horse, right? It was trying to have a flare-up of laminitis. And unfortunately, it did get the horse eventually. Like a really bad case of it. It turned to sinker. He came apart at the coronary band. He was starting to dipper open, and they wound up putting him down. And, the owner comes to me later and says, well, I guess you were right. I'm like, it's not about being right. But boy, did I learn a lot from that. I think one time Sasha and I, we were both driving separate, and quite a long phone conversation that came up. And we really war gamed that one out. And I learned a lot from that. We're not vets, but a metabolic horse might be suspicious, right? If you're seeing something,
Yeah.
they could be going into case of laminitis, even a small case.
And then that has come up with, there's a vet in my area that we work often together. We have a couple of very big accounts, and it's interesting where if I see one that is starting to appear a little bit laminitic, I'll let her know. And sometimes she'll be like, well, I was just about to inject that one, or I had, and I'm glad you mentioned that. So that kind of proactivity could save both of us from dealing with a really bad case like you're talking about. Yeah, I think it's great that we're able to have that conversation.
Yeah. So as long as we're on some banter, so she helped me a whole lot with AWCF stuff.
Did you? Yeah.
Oh yeah, yeah. We did a whole day of. I went to the MRI room and where she was doing MRIs, and man, that was some great anatomy and seeing what was going on, and it actually come back on the test. So when they threw down all the X-rays, and the last one he gets to, he's like, "Hey, I don't know if you're gonna know what this one is, but I'm like, oh, that's a picture of MRI," and he looks at me and I go, "All right, it's a sagittal or anyhow." I had to correct it, but he didn't think we were going to get it. I think we did 2 or 3 sessions of Zoom calls, and she just pounded me, and I mean relentlessly pounded me on X-rays to the point when that part of the exam, I mean, it was just like click, click, click. We're going through X-rays, and I'm telling the view what it is, and it made the exam easier than preparation.
Right. Yep.
She was really good at that, and really pounded me. And I mean, and after the test, and you're questioning yourself, I'm like, okay, did it, all the things you messed up, and I went, yeah, but I did really good right there.
Yeah, I knew I had that. Yeah.
The keratoma case and the canker, not so much, but the keratoma case came into play twice. Once in the written, I think it was, I'm trying to think of the question exactly now. It wasn't a keratoma question, but you'd handle the same. And I think it was a septic abscess question. And really, I just took my keratoma stuff. And I think dealing with the vet, and I just took our experience there and put it in words, put it on the paper. And then the interview with the panel interview with the 3, the last one was Simon Moore. And he threw down an x-ray and a picture, and it was a keratoma. And they were pretty good at, what's this? Or if they were nice, what's this? If not, they just threw a picture in front of you and looked at you. Yeah, the vet got me on that one pretty good, thumbed me up. But Mr. Moore put that down, and I looked at it, and I went, oh man, I've got this one. I went from, really, really bad question to that one, and then it was like all of a sudden you got your legs again, and you were able to cruise.
Yep.
And I tell you what, like, I don't think we can go through this test alone. And
no,
she was super helpful there on so many aspects of that.
That's cool.
And,
well, I've heard it mentioned many times in all the prep clinics, especially by those given by examiners, was that it's really a test to see your level of experience. And that's why they want you to go back and use the cases and the experience that you've already had and just demonstrate to them that you're at that level through that process. So you did exactly that.
It's, we'd work together on different things a bit. And as I started down that venture, I kind of reached out to her a little more because it was a vet I knew I could work well with. And I think that just really snowballed things with us working together. And so she was throwing me more stuff, and man, did it come in handy. I think the keratoma case, so I used it as a question and then did a write-up, kind of did a written answer on that. I went through all my notes and then sent it to her to beat me up on it.
Right. Well, okay. I figured this would lead into the NAEP. What got you interested in the NAEP and now being a member and on the board?
So a little bit was poking from Sasha. I think a couple of years ago they had, I think it was Jim Ferry, and she really enjoyed having him there. I was doing I can't go to the symposium, it's too close to test time. And what a mistake that was, missing out on that with him. But really it was kind of as I started down looking for knowledge, trying to prepare for the AWCF test. A little poking from her, but then I got looking at the stuff, started going to some of the wet labs. And then there was one in New Jersey, and I thought that one was really good. We did some leg dissections. I think it was Chris Gregory, and then you kind of got to pair up with a vet and do the dissection. So I was hitting some stuff, went to the symposium a couple times, and then last year she got a hold of me and says, "Hey, are you interested in coming on the board?" And after all her help, how do you say no?
Mm-hmm. Right. And what sort of time commitment is that? Like, how often do you have to have board meetings?
We have a board meeting once a month. Then there's the 3 wet labs, and then the strategic planning meeting kind of with all the board members incorporated with that. It's a pretty active board. It's a really good group of people, both sides, just pushing to try to make the organization better and get it out there. It's kind of an interesting, as they went from a regional group to now a national group, and I think there's trying to step into that national spot now and getting bigger. So now the wet labs have moved around a bigger radius of area.
So hence the name change from the NEAEP.
Right. Yep.
Okay.
So now NAEP. Correct.
Right.
What used to be Northeast Association Equine Practice. Now I think they may have changed it twice. And being so new to the board, I wasn't privy. I do find myself playing a little bit of catch up. That's why it was nice seeing her here, because she was past president. And she can rattle so much more of the history off, and I'm really still learning it.
Right. I'll ask you, I guess the main event coming up it's September, is it not?
Correct. It's September 24th to 27th in Saratoga Springs, New York.
Right. And what would somebody expect to see and do if they come for that?
There's going to be podiatry presenters, lameness presenters, and internal medicine. So it really kind of covers both vets and farriers, and really trying to get everybody together. Everybody's open at lunch to intermingle with each other. There is a mixer, I think, the opening night, which actually I'm looking forward to that. Gustafson, I can't remember his first name. He did the branding for the NAEP, and a really interesting guy. I think he did Harley Davidson, maybe, don't quote me on all of them, Disney, and it was kind of an interesting, gotta have a little bit of a branding your business lecture at the mixer.
Okay.
I think he win some drink tickets and whatnot, and just try to get everybody, break the ice and get everybody together in intermingling, make some friends for the course of the time you're there. And really kind of interesting because you make connections and you run into people elsewhere. In my times in Florida now, I'm starting to run into some of the vets down there that I've seen at the NAEP.
Okay. Yeah. So I attended one probably, I don't know how long ago it was. It was still the NEAP. And yeah, they had that mixer and that was great. You're right. It just sets you up for the relationships that you're going to build over the few days that you're there. And then you just keep running into each other over and over.
I mean, then it's kind of nice, you can bounce ideas off each other. And I thought, you come on this board and I was going to have a little time to find my feet. No, they threw me right under the bus. Immediately put me in charge of podiatry speakers for Saratoga.
Oh,
so I may have curved that a little bit towards people looking for higher exam stuff. So we've got Mr. Simon Ward coming, doing his presentation on dorsal hoof wall off of his thesis paper, the hind end of the horse. And then we also have Mr. Mike Poe coming. And I will say, Kevin Davis had a little mini clinic for us. It was a pre-certification trying to get ready. And I was the only one there that had passed the practical. I thought, man, there's not going to be much there for me from Mike Poe, but I really want to support this. Boy, was I wrong. Mike Poe, what an intelligent individual. He just asked everybody what they needed, looks at me, and goes, I got something special for you. Yeah, boy, he did. Everybody else went to the anvils and forges, and I went to the head of the shop at a dry erase board and stood there and answered questions. And I might as well have been there in my underwear. It was quite embarrassing. And, now everybody's taking a break and they're coming up trying to read your question. And of course he walks by and spelling is not my forte. And he just starts wiping things off the board. Spelling counts. And he finally figured out that maybe that was hopeless in my case. But man, he took me to task and it was really great. And then we also have Dr. Ellen Staples, who is DVM, but also a CJF in Ocala, Florida. And when we were down there on our last trip shoeing, she was hosting a certification for the AFA. Dusty Franklin was there. And got a chance to meet her and talk with her. It was really cool. When it was over, anybody that wanted to, she was going to do a tendinotomy on a laminated case. And we kind of all got to go and observe it. And it was really cool. And she started a little chat group. So I think, everybody, not every day as fair as we get to see that. And so that was pretty cool. And then I think Mike and Ellen are going to do a little kind of Farrier vet back and forth, what the vet sees, what the Farrier sees. And they've done some presentation together before. So trying to change it up a little bit and put both of them on together.
That's cool. That'll be neat.
Yeah. I'm not in charge of the lameness, but that's Dr. Ken Allen, Dr. Kurt Dahlberg, and then Dr. Sue Dyson's coming from England. So,
oh, cool. Quite the roster.
And unfortunately, I cannot tell you the short events, nor does it probably really matter on this with this crowd. But she's here. She can tell us.
Right. Yes, we have Dr. Teresa Burns. She's going to do a lot on endocrinopathies and their relationship to laminitis. And then Dr. Ben Sykes, who's one of the leading international gentlemen on gastrointestinal disease. So he lectured for us last year with gastric ulcers, and I think he actually really wanted to come back. So he's going to go, I think, a little bit deep sea diving on that. And then Dr. Steve Grubbs and Kelly Graber are going to be coming in, and they're going to do updates on internal medicine research, I believe.
Okay, cool.
Do you want to dive in on any of the lameness?
Yeah, I don't know exactly what their topics are going to be, but yeah, the whole lineup is great. It's really exciting. And I think one of my favorite things about the whole conference is just that it's so approachable. That was what got me into it at first, is that it's a non-intimidating environment, and even the big lecture hall isn't that big. And I'm not a person that likes to ask questions in front of large groups, and this is one of those that you can sit, listen, write some notes, and then maybe in the hallway, one of those lectures is chatting and you can have a conversation with that person later, or maybe at a bar down the road. There's a few of those in Saratoga, and just have a great time.
I know at lunch before I walk down that with the presenters, and while you're eating lunch, you can pick their brains a little bit more. And
that was the great experience I found. Even just in between lectures, you would stop and have those conversations with even other people who had attended and bounce the ideas or stuff that you might not have caught or understood off each other. It is a really neat environment for learning. So that would lead into, while we lost you, Sasha, I had asked Keith how he got his start with the NAEP, and maybe we'll get your background. What was your first experience with it? And then how did you then become so involved that you were eventually president?
So first interaction was Saturday of the conference is a wet lab day, and it's pretty well known. It's really wonderful because it's the application of all of the varying speakers' lectures, and then the application to real life, which at least for me, I'm such a tactile learner. It's wonderful to get that. And so one of the components of that day that has been a staple for a long time is there's an ultrasound component, and that is something that I do a lot, but obviously, like any diagnostic, practice makes you better, and then more practice makes you better than that. So I spent, when I went, I think it's about 8 years ago, I think was the first time I went. I spent all day in the ultrasound area and just rotated around from spot to spot, learning from all these great ultrasonographers, and then was able to take that home and apply it. And then in the sequential years after that, learned more from the baseline that I had developed, and then went out into the rest of the wet labs and saw all of these other aspects that these lecturers had provided. And what I liked was that you could float around. It was just so cohesive between the Farrier area and where the vets were and vice versa. So, you'd see someone talking about something they discussed during the week on foraging, and then there'd be a guy over there showing exactly his technique to do that. And am I ever going to do that? No, but at least hearing them talk about it and then the application of it just helped me then, okay, how that would work potentially in a case that I might have some vague knowledge about it for the future. And so that was really fun. And that's how I got my start with the NAEP. And then I think just through meeting different people that were already involved, that were on the board, there were several people that I just happened to meet that we were out talking and having a great time and discussing lectures. And then they were like, you've been a member for a while. Are you interested in becoming more involved? You know, it was just one of those right place, right time. And I definitely was. And I asked what that would be. And I was all in. I just thought this is such a great continuing education process. I love all of the people that I've been able to meet along the way. Everyone had this enthusiasm and hunger for the increased knowledge and for what everyone brought to the table. And I found that rather infectious because I hadn't been around so many people that just wanted to know as much about everything that was going on in the farrier world as with the veterinary world. And I really like that. We do a lot of unified lectures where both farriers and veterinarians are in the same lecture hall. And I'm sure both parties get different things out of those lectures, but yet we're all together learning it. And I think that's pretty cool. So being on the board has been fun because then I can play some small piece of the puzzle of creating who's going to come next year. That's always a fun game. And who's a hot topic name that people would like to see. Can we get them? And I think that's the fun part, is trying to get someone that would grab a large group of people and also try to get speakers that really exemplify what we represent. We just want great equine practitioners. We all work together. We're trying to help the well-being of the horse. And if we can do that through communication, continuing education, top dollar. That's the whole point.
Very cool.
Yeah, I think in her point in the wet labs, I guess I probably left that out. You know, it's really good. You hear the lectures, you know, for the 3 days, and then the lectures, now you get them not one-on-one, but it's a small clinic. Like the wet lab becomes, you maybe have 10 people, and now they're, like she said, the tactile learning or the kinesthetic learning in a small group setting. Really, I think really neat and helpful for me.
Yep. That would be the environment I would learn best in as well, for sure. And that I did miss out when I went. I didn't attend any of the wet labs, and I should have. I really missed out in that opportunity.
Are you going to come this year?
Unfortunately, while all those Brits are heading in your direction, I'm going in theirs.
Oh, are you really? Okay.
Right at the same time.
Well,
Fortunately not, but yeah, I wish Focus and what do you officially call it? I don't want to say convention. Is it a convention?
Yeah, no, the Saratoga Conference.
Conference.
Mm-hmm.
Okay.
Mm-hmm. Yep.
Yeah, unfortunately, they are always so close together that I haven't been in quite a while.
No, that's fair. We'll have to, this year it's September 24th to the 27th, but it's usually that later week in September every year, that Wednesday through Saturday, Wednesday, Thursday, Friday are lectures, and then Saturday is always the culmination of all of that. You know, some people attend for part of it. Some people, that we've set it up so that you can just attend the wet labs if you're interested in terms of registration. And registration is online. It's very easy. You just go to the NAEP.com website, and then you can access it through there. And I think they just have it listed under the Saratoga Conference. And then they have information about it and registration and who the speakers are and all of that pertinent information. But I don't know. We'll have to get you to come, Brian. We'll be back someone in the future.
Yeah, no, looking forward to it.
Yeah.
And after that conference, what is the next event that you guys are hosting? Because I know now you're hosting them all over the country, basically, are you not?
Yeah. So that's been a really fun endeavor that we've taken on over the last, really since COVID, the last 3-4 years. So we have more regional wet labs is what they call them. And we'll be having more for 2026. We usually do 2 to 3 every year. And to your point, yes, all over the country. 2 years ago, we actually had one in Calgary, Alberta. And there's discussions of potentially going abroad as well for upcoming years. So we'll have to see where we end up. We're still working on the 2026 regional wet labs, but we usually have them in February, March, and April. And again, those are small group interactions, usually anywhere from 20 to 40 people. And it's usually a Friday and Saturday endeavor. Sometimes there's a different layout, but maybe a Friday evening lecture and some food, and then a little lecture Saturday morning, and then the rest of the day is all hands-on, dependent upon what the lectures were covering. And if you're a member, you get a discount. Same with, obviously, the Saratoga Conference. And that's just trying to encourage people to, perks of the membership, if you will, for the NAEP.
And I guess while we're on that topic, what does a membership entail?
So you get access to our website, which we do have an online magazine. So the Horse Vet Farrier magazine that comes out quarterly. And oftentimes that has some really interesting articles in it. Some are articles or the synopses of some of the previous lectures from the Saratoga Conference. And then some are some of our previous lectures that we've had in the past, and they regularly contribute to the magazine. And we always try to have both Farrier and veterinary, interesting articles for everyone. We also have an online educational library that you get access to. So that has a lot of some of our lectures have been recorded in the past, and so you can access that. So there's a big volume of information there. I've used that in the past because I'll remember that somebody did talk about something, and I'll pull that up and, oh yeah, that was great. And then I'll review that and go through it. So we have different archives in that sense. But really and then there's a networking ability to find out other membership as well. So those are really the big things for our members, trying to really share and spread the word for all of us being together for the horse, because that's really the whole point of the entire community, is having veterinarians and farriers in the same capacity learning together. And we also have, I think for next year, we're going to try and have one of our wet labs we're going to launch something that we've been working on for a long time. It's it's called the STEP program. So shared teaching of equine podiatry. And so I think one of our wet labs is going to be focused on that. And obviously there'll be more to come with that and what that means, but we're going to try and launch that at that time as well.
Very cool. So there's a lot.
Yeah.
Awesome. Yeah. Is there anything else I'm cognizant of the time and I don't want to keep you much longer, but was there anything else either of you wanted to touch on while you have the platform?
While I'm actually connected.
Yeah, exactly. We're on a run here.
I think that covered my end.
Gosh.
Okay.
Yeah, no, I knew you were talking a lot, Keith. Sorry.
No, it's all good.
I just really appreciate, first of all, Brian, you're probably one of the most patient people I've met dealing with me. It finally just slowed down on the reins. So I truly appreciate you beyond words. As I was logging in and out for the 15th time, I thought I need to send this man a gift.
I appreciate that you hung in there and kept logging back in.
Yeah, I'm sorry that the internet connection was unfortunate, but I'm glad that it worked out, and I just really appreciate you allowing me to come on, and it worked out having two people.
Yeah, doing it in this format, it's been great. And I'm just really happy to be able to share what you guys are doing. It is important. And we had a group here in Ontario, Foot for Thought, and we did a lot of events. It was just vets and farriers and other equine practitioners. And there was so much good that came of that. And what you guys are doing, it's that on a much larger scale. And I can see how fruitful and fulfilling that it can be. I know how much work it is to put this stuff on. And yeah, I appreciate that you both put in the time and effort to do it and to do this to help promote it too. So
for sure. Thank you.
Yep. The more people who know about what you're doing, the better.
Yeah. And I think it just helps the industry, right?
Oh yeah. Big time. Yep. Yeah. Thank you both for sharing your stories. And
thank you.
This has been amazing.
Thank you. I hope you have a great evening.
Thanks. You too.
Well, that's a wrap on another episode. If you enjoyed today's conversation, please be sure to tell your friends about it. Thank you for listening and, of course, for your support. Until next time, take care of yourselves and each other out there. We'll talk soon.